Hello students, myself Paramat Hardik. Today I will discuss you about what is Venturi mask, what are the parts of Venturi mask, what are the color codes, what are the flow rate of that color codes, and indication and nursing responsibility of Venturi mask. Okay, so first हम देखेंगे what are the parts of the Venturi mask. So it is consists of first of all, oxygen mask that covers the nose and mouth. Then second is a corrugated tubing, oxygen line, fixed orifice device, or also known as a Venturi valve. Okay. So first of all, you can see in the pictures that this is a oxygen mask which is generally cover the nose as well as mouth, and the second part is a corrugated tubing. This one is a corrugated tubing. ओके, और ये क्या है? ये है ऑक्सीजन लाइन और ऑल्सो नोन एज अ ट्यूबिंग, ऑक्सीजन ट्यूबिंग which is directly connected to the oxygen source or tank. Okay, then also fixed orifice device which is also known as a Venturi valve. Okay, so these are the fixed orifice devices or Venturi valve, okay, which is connected to the oxygen line and corrugated tubing. Okay, so fixed orifice device is also very important and they are available in various type of color, which is very important. The next part is also very important. Okay, so it is known as a air entrament collar, which is called as air entrament collar. Okay, so this is a part of air entrament collar. ये क्या है? एक it is a one type of plastic cap which is covers the venturi valve. Okay, so ये क्या करता है? Exactly ये कवर करता है जो वेंचुरी वाल्व है, ये वाल्व इसको कवर करता है, which is very crucial. Okay, why? Because if if the patient's hands or towel are touch or block that particular valve, then it increase the flow rate of the oxygen because of the certain, okay, because of this type of holes. Okay, it also create more problem to the patients. Because of that reason we have to cover air environment column. Okay, so these all are the parts of Venturi mask. अब हम देखेंगे how it works or what are the principles of Venturi mask. Okay, so first, the unique features of the Venturi mask is ability to deliver a specific oxygen concentration by controlling the amount of oxygen mixture that enters the mask. Okay, Venturi mask में क्या है? हम specific oxygen concentration दे सकते हैं patient को. Okay, so this is achieved. ये कैसे होता है? Achieved through the use of Venturi principle के जरिए हम अचीव कर सकते हैं, where the flow of oxygen through a narrow constructions, a flow of oxygen through a narrow construction create a low pressure area. This low pressure area draws a specific amount of additional fluid such as room air through the side opening inlet. Okay, so Venturi वाल्व से वो इस प्रकार बना हुआ होता है जिससे लो प्रेशर क्रिएट होता है. इसकी वजह से जो एडिशनल एयर है विच इज रूम एयर, वो एंटर होती है थ्रू द साइड ओपनिंग और इनलेट इन वेंचुरी वाल्व्स. This thing happens due to the constructions of that Venturi valve. Okay, the next is the mask is typically has a color adapters or a valves that correspond to different oxygen concentrations. Each adapter is designed to allow a specific amount of air to be entered रिजल्टिंग इन प्रिसाइज ऑक्सीजन कॉन्सेंट्रेशन बीइंग डिलीवर टू द पेशेंट्स। अब क्या कह रहा है, मास्क जो भी हमारा वेंचुरी वाल्व है वो अलग अलग कलर कोड के आते हैं। ओके, इसकी वजह से ईच एंड एवरी कलर कोड हैड दैट डिफरेंट डिफरेंट टाइप ऑफ ऑक्सीजन कॉन्सेंट्रेशन। They are specifically designed with a specific color, and it allow the specific amount of air to be entered. Okay, you can see in these pictures there are various kinds of colors like white, yellow, red, and blue. Okay, each and every valves have different types of oxygen concentrations amount. Okay, then next क्या है, this allows to healthcare providers to adjust the oxygen concentration according to patient's needs. Okay, जैसे जिस पेशेंट की जरूरत होगी उस प्रकार का हम वाल्व्स चेंज करेंगे। अगर ज्यादा होगी तो ज्यादा की डिमांड होगी तो हम कलर कोड अलग करेंगे यूज, और कम की होगी तो कलर कोड अलग करेंगे। ओके, सो हमने फर्स्ट देखा पार्ट्स ऑफ द वेंचुरी वाल्व, then what are the principles of venturi valves, then color adapter, then we will discuss about the color coding. Okay, so this is the table of color code, flow rate and FiO2. Okay, so you can see this is different colors of tables like blue, white, green, yellow, red and green. Okay, so क्या कहते हैं, तो 24, okay, 24 amount of oxygen FiO2, then 2 liter per minute flow rate. 28, this is 4 liter per minute. 31 percentage 6 liter per minute. 35 percentage 8 liter per minute. 40 percentage 10 liter per minute. 60 percentage 50 and 50 liter per minute. So these are the right side, you can see this is the FiO2 value, and left side you can see the flow rate, okay, liter per minute of oxygen. ओके, एंड जो जो भी ये ग्रीन, रेड और येलो है ये एक्चुअली में क्या है, वेंचुरी वाल्व्स है। ओके, अब हम देखेंगे इंडिकेशंस ऑफ वेंचुरी मास्क। ओके, so there is a one respiratory condition which is known as a COPD. It is also known as a chronic obstructive pulmonary disease. ओके, इसमें ही हम वेंचुरी मास्क प्रोवाइड करते हैं पेशेंट को। क्यों? क्योंकि सीओपीडी में CO2 रिटेंशन ज्यादा होता है। ओके, CO2 रिटेंशन ज्यादा होता है, इसकी वजह से we cannot provide 100% oxygen to the patients. It might be complicated to that this condition. Okay, because of that reason we have to provide venturi mask to this kind of or this kinds of disease related patients. अब हम देखेंगे what are the nurses responsibility while providing venturi mask. Okay, so first positioning. Okay, we have to provide proper position to the patient while providing venturi mask. Not only venturi mask, but there are also other oxygen administration methods. We have provide focus on positioning. Then also check any complication while providing venturi mask. What are the respiration rate? What are the heart rate, temperature, or others? We have to check. Check the venturi valves. This is the most important thing. Why? If the venturi valve block or certain things inside it, that might be problem for the patients. Okay, so हमने इस वीडियो में क्या सीखा? फर्स्ट, व्हाट इज द वेंचुरी मास, पार्ट्स ऑफ द वेंचुरी मास, प्रिंसिपल ऑफ वेंचुरी मास, डिफरेंट कलर कोडिंग, indications and nursing responsibility. Thank you.